Welcome everyone to this second season of GGP-connect Insight and Impact webinar. We are happy to resume this webinar series. My name is Vitalis Juozas-Deimantas. I am the Research Infrastructure Manager of the GGP, and I'm also joined by Aisling Connolly, a researcher at the GGP as well, who's behind the functioning of this webinar today. I'm happy to welcome Madam Kreidl of Masaryk University, as well as Anna Šťastná of Charles University, who will be presenting GGP Czechia and sharing the recent experiences with data analysis, knowledge dissemination, and policy impact. A reminder that this updated format of GGP Connect is aimed at encouraging our partners to showcase insights in GGS-II, highlighting the effective communication practices together with policy aspects and communicating those to policymakers, funders, or general audiences. This is an excellent opportunity for the GGP community to learn more from each other and as well apply the lessons learned in their own national contexts. A few housekeeping points before we start. A reminder that this webinar is recorded, and if you have any questions, you're more than welcome to type in those questions in the Q&A at any point of the presentation, or should you like to raise your question yourself using your voice and video at a later stage, there's going to be a Q&A session at the end of the presentation. So without further ado, let me give the floor to Martin and Anna, and it's all yours.
Okay, perfect. Thank you. Could you please someone indicate that you can see my slides?
Not yet.
Well, it appeared here for 2 seconds. Is it better now?
Yes. Yeah.
Okay, perfect. So, welcome everyone. I'm going to walk you through the first half that will focus mostly on the scientific use of GGP data. And then Anna will take over to talk about knowledge dissemination and policy impact. Well, my part, as I said, is going to be focusing on research, specifically on published papers. And to explain what is the population of papers that I want to discuss, I need to remind you of the history of the second cycle of the GGP in Czechia. So wave 1 of the second cycle took place between November 2020 and July 2022. In addition to that main study, we also organized an online pilot in December 2020 with a follow-up in April 2021. This is a separate data file, but it will come up in several of the papers that I will be discussing here. So you need to be aware of those 2 data sources that in my universe fall under the title of GGP-II in Czechia. The main study data were released in March 2023. So the period that I reviewed is 2023 and 2024. I wanted to focus on all papers and see what topics they cover and what design choices the authors made when preparing those papers. There are a few general remarks that I want to start with before I dive deeply into the specifics of Czech GGS. Well, the population of papers that I want to cover was defined with the aid of the GGP bibliography, of which I believe most of you are well aware. So when you check it online, you will see that there is a total of 50 papers, 50 entries in the bibliography. Of those 50 papers, 35 were published in 2023 and 15 in 2024. I needed to do some cleaning because this bibliography is not perfect for my purpose. So I removed some duplicities, some papers that apparently were entered into the database by mistake. I also removed non-research papers such as editorials or discussion papers. I do not want to focus on methodological papers. There were quite a few methodology papers published recently. And I also have to remove a few publications that were not accessible to me for language reasons, or because there was some mistake in the hyperlink, so I couldn't access the publication directly. So of those 50 papers from the GGP bibliography, 30 papers are papers that I consider substantive research papers. Plus, there is a non-random selection of other papers that I added to the database. 10 papers, all by Czech authors, that didn't make it to the bibliography yet. So I have a population of 40 papers that I want to discuss and elaborate on. Some of the general points, the design issues, that was an interesting. We very often tend to boast that GGP is a comparative project, but in the published papers, single country studies tend to dominate over papers that use multiple countries. Also, another added value when we discuss infrastructures such as GGP, Share, European Social Survey, and others, we tend to boast that the panel design is a strength of the GGP, but to my surprise, only a minority of published papers actually use the panel component of the GGP. So of the 40 papers that are in my population of publications, only 10 used the panel component in one way or another. And then I wanted to see the share of papers that use the second cycle of the GGP as compared to the first cycle. And I was also curious to see if there are already papers that combine the first cycle and second cycle data. And there were 2 so far published. So still the user community predominantly rely on the first cycle of the GGP. And 2 additional general points. Only 2 papers used harmonized histories, and no paper, as far as I was able to infer from the publications, no paper used the contextual database. I do not want to speculate why those 2 data products are not used more frequently, but this is certainly something that we collectively should spend some time thinking about. Now, the Czech data. So of those 40 papers, 19 papers use Czech GGP data. 11 of those 19 papers are single country studies, and in 8 papers, Czech data appear along with data from other countries in some kind of multi-country comparison. And 10 papers of those 19 use the GGP-II data. So in this particular case, the new cycle already slightly dominates over the old cycle. So the uptake was quite quick in my perception. Now, so we have 19 papers that use the Czech GGS data, and this is the population of publication that I'm going to discuss from now on. Topics. Well, this is a very broad categorization of topics as they appear in the titles or abstracts or keywords. One paper may fall into multiple categories, so this is not a mutually exclusive categorization. So we have one paper about unions and partnerships, one about caregiving, one about parenthood, and everything else is about reproductive behavior or health or reproductive plans or intentions. By far, the most frequent topic is reproductive behavior, which in my definition also includes analysis of contraceptive use. So 6 papers out of those 19 focus on this particular aspect of demography. So this is the overview, and now a few selected findings. One is about union instability. This is a paper that came out last year in demographic research, and it shows how various measures of relationship satisfaction or separation proneness developed over time. That is one advantage of the long period of data collection, that we can split it up into bi-weekly or weekly periods and compare how things developed over time. And one interesting finding from this paper is that at some point, over 35% of people, specifically women with lower education, admitted that they had been thinking about breaking up with their partner. And apparently, these are the most vulnerable respondents in our sample. So that's one example of our analysis of union instability. Another example from the published research is caregiving under COVID, and this is one of the papers that uses our pilot study, including the follow-up, so it can actually review what happened with caregiving in families across 3 different lockdowns in 2020 and 2021 in Czechia. What is interesting in this graph is that about 1/2 of all families employed the same system of the division of labor in households across the 3 lockdowns. And not surprisingly, 1/3 of families applied always the women model. So the gender imbalance was massive there. Another paper which I think brought interesting results is this paper on contraceptive use that takes both the GGS-I and GGS-II data from Czechia and shows some quite strong trends. First, reliance on the pill among all women went down from 50% to 30%. And that's a time span of less than 20 years. When we look specifically at women between 18 and 27, then reliance on the pill went down from 76% to 37%. This was partly offset by reliance on other family planning methods, such as condoms, that went up from 21% to 35%. But surprisingly, we also identified a growing share of women who rely on a no birth control method. There were 17% of such women in the age group 18 to 27 who reportedly did not use any birth control method. So that's contraceptive use. And finally, reproductive health. GGS-II data in Czechia revealed that 27% of men and women at the end of their reproductive age report that they ever experienced any reproductive health issues. So they were unable to conceive a child after more than 12 months of trying. So it is a significant number. 5% of all adults report that they have direct experience with assisted reproduction. This is actually for the first time that, as far as I know, we can provide such population-wide estimates based on representative samples of the population. So that was my part, and now Anna is going to take over and explain how GGS data were used for public policy impact.
Thank you, Martin. I hope everyone can hear me. Greetings to everyone from Prague, and in the remaining time, I would like to focus about public policy impact and knowledge dissemination of our results. It's important to say at the beginning that the policy impact or dissemination of our results was from the beginning at the heart of the GGP Czech project, because GGP, the second round of the GGP Wave 1 was collected thanks to financial support of the Technology Agency of the Czech Republic. And the research programs of this agency support research and innovation of applied social sciences and humanities. And the aim of this program is to strengthen social and human dimension in activities of applied research. That means in practice that the relevance and usefulness of research, or of our research in this case, should be supported by the so-called application sponsor, even to be able to ask for funding. So discussing and planning the outputs with relevant stakeholders, and also the ways how to implement these findings were a key part of the project from the time of its preparation, not only the thing that we discussed at the end. So next please, Martin. Next slide, please. Thank you. And therefore, from the beginning of the project, we have two target areas for the implementation of results, because we had two types of these application sponsors. One was the Ministry of Labor and Social Affairs of the Czech Republic, which was the main application sponsor of the project, and the focus for the ministry was, of course, family policy issues. At the beginning, we discussed the broader topics that the ministry is interested in to get up-to-date data, and as outputs, we presented 3 research reports based on GGS data and focusing on 3 broad topics. One was work-life balance, one was economic situation of families and household, and working conditions, and the third broad topic was partnership, parenthood, and reproductive plans. Besides these research reports, we organized workshops for the ministry on a yearly basis on these topics, where we discussed the quality of data at the beginning of the project, and later on in the end we presented the most important results, and we discuss these and the implementation of this. Next slide, please. Thank you. The second area of implementation of our results was the topic of reproductive health, because from the beginning of the project, we cooperate with 2 professional medical societies. So there are 2 other application sponsors. One was Czech Gynecological and Obstetric Society, and the second one was Czech Menopausal and Andropausal Society. And these medical societies were interested specifically at reproductive health, contraceptive behavior, and fertility postponement and health-related issues including medical assisted reproduction. All these data we have in the GGS sample. Therefore, within this topic, we prepare again research report based on GGS data, but also a special issue for Journal of Czech Physicians, and these results were both focused on changes in reproductive behavior and the consequences for reproductive health and health-related issues. Next, please. So this project, focused by technological agency, was successfully completed at the end of the last year. We are happy to say that since the early 2024, GGP CZ is already on the roadmap of large research infrastructures of the Czech Republic. However, the close cooperation with those stakeholders and implementation of results in both defined areas continues. Next, please. Regarding family policy and fertility topic, Ministry of Labor and Social Affairs established expert group for demographic stability. This group was established during September this year as an advisory body for the minister. The establishment of this expert group was mainly in response to recent demographic development. As you can see, after the long-term increase of TFR in pre-pandemic period in the Czech Republic, we can see a sharp drop from 2022, and according to preliminary estimation, we are heading towards the lowest low threshold of fertility for this year. And of course this, but also the sharp decline in number of live births, which is the indicator which is in the spotlight of stakeholders more frequently than the TFR. This fact was the main reason why this expert group for demographic stability was established, because maintaining demographic stability is one of the priorities in the family policy strategy for the period 2024 and 2030 of the Czech Ministry of Labor and Social Affairs. And it's important to say that we have two representatives of the Czech GGP in this advisory body. Martin is member of this expert group, and Jiřina Kocourková, the head of the Department of Demography at our university, is the chair of this expert group. And up-to-date data and results from GGS is, of course, discussed and presented within this expert group. Next, please. Given the current demographic situation in the Czech Republic, there is growing interest in GGS results from the political representation, also not only in the context of fertility and family issues, but in the context of pension reform as well. Therefore, we were invited this year twice to present our results in the Parliament of the Czech Republic. The first presentation was for Standing Commission on Family Issues, Equal Opportunities and Minorities, where we presented some results concerning current fertility trends and family issues. And the second topic was again presentation of results for a roundtable on demographic aspects of pension reform, which was again at Chamber of Deputies of the Parliament of the Czech Republic at spring of this year. Next, please. And going back to the second topic, so second broad topic of reproductive health, we have presented selected results quite extensively at medical attestation courses and medical postgraduate training courses which are included in the system of continuing medical education. Within these courses, results from GGS data are usually presented within the broader context knowledge of reproductive behavior and reproductive health. And the interest in GGS results is mainly expressed from the field of gynecology, obstetrics, and reproductive medicine. I listed some examples of medical educational events during this year where we had presentations. The titles of our presentations are in the quotation marks, but you can see that this continuing medical education is both in the field of general practitioners, but also attestation courses for gynecology and obstetrics, for fetal and perinatal medicine, and also courses within the context of reproductive medicine and in contemporary society. So this was, we are on time, good. This was all from our side. You can see that we try to maximize the impact and to broaden our results and our knowledge to stakeholders. And given current situation, both with respect to fertility development, but also population aging, it seems that both policy representation and stakeholders from medical societies are very willing to hear our voice and to see the results. Thank you very much.
Thank you, Anna. Thank you, Martin, and congratulations on impressive work. I must say this is really a comprehensive approach to what GGS can provide as a evidence source. Thanks again, and I open the floor to everyone to pose questions. I think there's surely more than one that should be coming your way. While people coming up with questions, and a reminder that you can either add your question into the chat or just raise your hand. I'll use the privilege and ask a question myself. From what I've been hearing today, I got this impression that it feels like that you've been doing a very good job in promoting the life course approach. It looks like that your institutions not only, target these point issues such as fertility, or, like I'm family planning needs for that matter, but there's also this indication, even if, slight, that different types of committees being set up that also include not only fertility issues, but, aging pensions, that bit. And obviously these societal tendencies are related to. Do you think that this intuition that I have from your presentation is correct or a bit premature?
Yes, I agree. Many of these stakeholders do understand that those issues are interconnected, and that we cannot really think about the future of the pension system and the retirement age and well-being of pensioners without understanding what is happening at the beginning of the life course. Of course, sometimes when we discuss those issues, it may appear to be too complex for policymakers because they want to, ideally identify a single cause that can be somehow changed, and then everything else is going to change. But we need to educate people around us and explain that the social world is very complex and that there are no magical single solutions. But yes, very often the discussion is very complex.
Thank you. That's actually also an impressive addition to the conversation that we're having about these population change and demographic issues. I see that Laurent Tillemont from IMED has raised his hand. Please go ahead.
Hello. Well, thank you very much for the fascinating presentation. Sorry, I was a little late. I could not hear the very beginning. I had a technical question about wave 2, the follow-up of the GGS, as your wave 1 was spread along more than 1 year. Do you know how to try to have a 3-year interval between wave 1 and wave 2 for most of the respondents? How do you intend to consider that issue that many other countries may face because of this length of wave 1? Thank you.
Yes, so the main idea is that, yes, fieldwork in wave 2 should take no more than 8 months. So it should be much shorter. That's point number 1 for logistic reasons primarily. Point number 2, we want to make sure that for each respondent, there were at least 3 years, that is 36 months before interview 1 and interview 2. But apparently for some people, the interval is going to be longer. So we have stipulated in the tender for wave 2 survey agency that we will actually break the fieldwork into stages, and in each stage they will only be able to approach a particular group of respondents. So we will start in January when fieldwork is supposed to start. We will start with the earliest respondents to wave 1, and then we will move forward through those 18 months of wave 1 data collection and release additional groups there. So no one will be asked to fill wave 2 questionnaire unless 36 months went by since interview 1. But for some people, the period is going to be longer. For some people, it could be, 3.5 years or almost 4 years. We couldn't think of a better method of organizing wave 2 interviews.
Thank you. More questions? Let me see the chat. Right, yeah, well, I also asked a question now because I felt a bit curious about the part where you presented, Anna, that was you, where you presented the contraceptive views and as well, and family planning in that regard. What I found quite fascinating, and I think that's also exceptional in the Czech context in comparison to other countries, is that you were working closely with medical professions, if not professionals. And you also got invited, to present in, well, let's be honest, in fields that we don't necessarily, as sociologists or demographers, get to visit. And I thought that was really interesting. That also shows how, you can build connections and networks in other adjacent fields and really spread the demographic or sociological knowledge and actually use that data. Do you have any advice how our colleagues could replicate that in their own context and reach out to other disciplines?
I'm not sure whether I have an advice, but I feel, or my experiences from this presentation says that it's really important because those professions are usually focused on clinical studies or on small sample studies, and very frequently they don't have general knowledge about population-based data, about sample survey data, and even they are not well informed about data which are in the close relation to their profession. For example, gynecologists and obstetricians often don't know much about fertility trends, about they know very detailed specific cases from clinical studies. They know all these mechanisms. However, the fertility forecasts, which will influence their profession, because the drop of fertility will probably raise the question about reducing medical services in certain parts of the Czech Republic. They are not aware of this in such a detail. So I feel that's very useful to show them these data, to show them different approach, to show them population-based data or representative data from the sample surveys. And the feedback is very positive from them, because yeah, I think we should educate these professions to take and to work with our data in the same way as we time to time goes to medical science data and study their results from their clinical studies, small sample studies. But easy way how to make a connection, I don't know. I don't have an advice. It's usually, but I'm sure that in every country, these lifetime learning, these courses that are obligatory for medical professions are organized, that professional association, professional societies organizing these courses exist. So maybe get in touch, going to their conferences, try to present the overview which would fit into their topic and into their professions will be the good way how to start.
Good points, and I think most of them are really actionable. Reaching out to people is, I think, pretty clear. And I think another element is that with data sets like GGS, we can really, bring something to the table, especially the big sample size is something that is really not that common in other social science fields, or really in that regard, clinical studies. So yeah, points taken. And also, again, very interesting to listen to your own experience. Have we got more questions? I think we've got time for one more question. Yes, Eva, bonjour. Thank you.
Hi, sorry, I was even later than Laurent. Sorry, I was even later than Laurent, so I was waiting for the link that wouldn't come. And so I have a general question then, because I don't want to ask about some things I haven't seen, but were you ever feeling constrained by the fact of working very closely with policymakers and having to rely on their funds and having to give them reports? How is it like embedded in your work, and is it something that after all it's very manageable, or is it something that's really putting lots of pressure on you?
I think, Anna, you should answer that question, because you are or were the primary contact between the GGP and the Ministry of Labor and Social Affairs.
Yeah, well, let's say we don't have another option. Like the financing of this project is yeah, in the Czech Republic there are not so many options to fund this project, and if there are some, we have to go there. Yeah, like fortunately now we are research infrastructure. Hopefully the future GGS waves will be easier for us. But so far we usually had to cooperate very closely with these administrative bodies to secure financing, funding, and yeah, that was a condition. But I think it's manageable and it's useful, because like we are, or even our department is not here just for basic research, but the implementation and implementation of results of demographic research and sociological research is the base of our work. So we are in the contact with ministry, not only because of GGS, our colleagues working before were working for pension commissions and all these things. So it's part of our work, and yeah, I don't think that that's something that would we can't manage somehow.
Okay.
Let me just add one minor additional point. It is very often very sensitive because, yes, the ministry has been interested in the GGP for quite a few years now, and they helped us a lot in the process of becoming a research infrastructure and in the process of being included in the national roadmap. And now, we are an infrastructure, and each couple of years we will be evaluated on the basis of several performance criteria. One of them is, of course, the social and economic impact. And the other criteria are, scientific outcomes, the number of users, the usual stuff. And now we need to really work on the proper balance between the academic and applied emphases in our work. So some people at the ministry feel, well, we helped you to become an infrastructure, so now you should be serving us. We need new data, so why don't you use your infrastructure data to collect something that will be tailor-made for the purpose of the current debate? And then I need to explain to them that this project has also an international dimension when we need to implement the common methodology at specified moments in time. So we cannot use all of our funds just to satisfy the momentary needs. And of course, those negotiations will start all over again next year after the elections. There could be a different minister, different group of advisors, different personnel in different departments of the ministry, and they might have different emphases. And again, they might have this expectation that, we should be their servants, which is to some extent true, but not fully. So it requires a lot of very subtle conversation.
It does sound like a balancing game. Thank you for the question, and thank you for the discussion. I think it's time to officially close the webinar. So thanks again to Martin and Anna for presentation and providing us with food for thought and discussion. Thank you to Aisling for running the show, and thank you everyone for joining us today. And